Okay, let's unpack this. We're diving into a really fascinating idea today, drawn from the source material you've shared. It's about using oxygen, basically just breathing extra oxygen before you face some kind of challenge.
Right.
The core concept, it's essentially giving your body a bit of a head start, like a controlled nudge to fire up its own defenses, its protective systems, before the main event hits.
Exactly. Think of it as prepping your internal machinery. It leverages the body's, well, its incredible resilience.
Hmm.
The sources suggest that a specific managed dose of oxygen can trigger these shifts right down at the cellular level,
Mhm.
making tissues more robust, really ready for stress.
Okay, and one of the sort of classic examples the source material looks at is in diving,
Yeah.
right? Helping prevent the bend.
Yes, decompression sickness. It's a perfect illustration.
Yeah.
Imagine you're descending deep underwater.
Okay.
Under that huge pressure, gases from the air you breathe, especially nitrogen,
Hmm.
dissolve into your body tissues. Now, the problem comes when you ascend too fast.
Ah, right. The pressure drops.
Exactly. And that dissolved nitrogen can suddenly form tiny bubbles in your tissues, your bloodstream. That's the bends.
Nasty.
Very. So the source explains how breathing oxygen before the dive, they call it denitrogenation, helps wash out, get rid of a lot of that nitrogen before you even go down.
So you're removing the raw material for the bubble.
Precisely.
Right.
Like clearing out potential trouble spots ahead of time. And studies looked at this using oxygen at normal pressure, or even slightly higher, hyperbaric oxygen.
Okay. That makes a lot of sense for diving. So taking that idea, preparing the body before a stress, how does the source show this working in, say, medicine? It mentions protecting against ischemia-reperfusion injury.
Yeah, it sounds complicated, but the concept the sources describe is actually kind of paradoxical. The damage happens not just when blood flow is cut off, but when it comes back.
When it's restored, that seems counterintuitive.
It does, doesn't it?
Mm-hmm.
But think about surgeries or other events where blood supply to tissue gets temporarily blocked. Restoring that flow is crucial, obviously.
Right.
But that sudden rush of oxygenated blood back into the tissue can trigger a burst of inflammation, damaging substances. It's a shock to the system.
I see. So oxygen preconditioning here tries to make the tissue tougher or ready for that shock.
Exactly. Priming it before the blood flow is even interrupted so it can handle that reperfusion better.
Okay. And where are we seeing this explored according to the source material?
Well, cardiac surgery is a big one mentioned, especially before coronary artery bypass grafts.
Mm-hmm.
The sources point to studies suggesting, real potential benefits with hyperbaric oxygen beforehand. Things like potentially better heart function right after the operation.
Wow.
Maybe shorter stays in the ICU and less inflammation or even post-op confusion, particularly with procedures using a heart-lung machine. That's pretty significant stuff the source is talking about.
Definitely significant. What about really sensitive areas like the brain or spinal cord?
Yeah, incredibly sensitive. The source does mention that oxygen can boost antioxidant enzymes in the brain, which theoretically should help protect it.
Okay. Sounds promising.
It does, but here's the catch. While animal studies look good, the human clinical trials looking at actual neurological outcomes haven't really shown clear, definitive benefits yet.
Oh, why might that be?
Well, the sources suggest it could be complicated by the patients themselves. Often these are older people, maybe with lots of other health issues going on.
Hmm.
It just highlights how tricky it is to translate lab findings into complex real-world situations.
Yeah, that makes sense. It's rarely simple. I also saw something about major abdominal surgery, pancreas operations.
Yes, exactly.
Yeah.
There was a study highlighted using hyperbaric oxygen before pancreas surgery, and this one had a really interesting kind of unexpected finding in the source material.
Oh,
So the study didn't find big differences in things like inflammation markers or how long people stayed in the hospital compared to those who didn't get the oxygen.
right.
But the group that got the oxygen pretreatment reported significantly lower pain levels, their self-reported pain, a full 30 days after the surgery.
A month later. That's fascinating. Lower pain, even if other stuff looked similar.
Exactly. It's a notable finding. The source discusses maybe the specific surgical technique used, robotic surgery, already minimized some of the immediate effects, but that long-term pain difference really stood out.
Huh. And the source touches on other areas too, briefly.
It does. Things like maybe improving how well skin grafts take, potential interactions with certain drugs.
Yeah.
But these seem to be in earlier stages, according to the source,
Mm.
often starting with animal models and needing more human studies.
Okay. So, stepping back a bit, how is this oxygen preconditioning actually supposed to work? What's the thinking behind the protective effect?
Well, the exact nuts and bolts are still being figured out, active research.
Mm.
But the main idea the sources point to is that this controlled oxygen exposure sort of primes the pump for your body's own defenses.
Mm.
It's thought to ramp up your natural antioxidant systems, maybe influence things at the genetic or enzyme level within the cells. Basically, this prep work makes the tissues more resilient, better able to handle the stress when it actually hits.
Okay. So let's wrap this up then. The core idea, whether for diving pressure or surgical stress, is using oxygen proactively, triggering your body's own protective gears before the challenge arrives.
Precisely, activating those internal safeguards in advance. And as the sources show, while we've seen some really intriguing results diving cardiac surgery, that surprising pain finding there's definitely still research ongoing, we need to fully understand how it all works and, how best to use it widely in clinical practice.
It really is something to think about, isn't it? That a relatively simple intervention, just breathing extra oxygen in a controlled way, could potentially prime your body for recovery in such powerful ways. And this whole field is trying to unlock exactly that potential inside us.